we don't want to keep our
I have
guests
to write
waiting,
you up
so.
again.
Dr. Ryan Smart, so sorry to keep you waiting for this this nonsensical conversation. How are you today?
I'm good, guys. Thanks.
All right. So let's talk some injuries. And we saw a setback last night, potentially, for Alexander Ovechkin in his race to break Wayne Gretzky's all-time goals record. He's 39 years old now. He's never had a major injury in his NHL career. He knocked knees with a defender and had to leave last night's game. What type of injury are you looking for after a collision like that, where there's forcible contact, the knee buckles, kind of goes inward? What kind of concerns would you have if you're a Capitals fan?
Usually that's a good way to do damage to the ligament called the medial collateral ligament, the MCL, when the knee buckles in. And if the damage or the force is severe enough, it can lead to also tearing the meniscus and worst case scenario, even into the ACL. So obviously you hope none of that is going on, but I think that mechanism certainly will at least at minimum sprain his MCL, which will make him sore. And but usually they'll MRI it, make sure nothing else structurally is going on. If it's just the MCL, that's a recoverable injury, no surgery, you heal. He's obviously a tough guy, and hopefully he'll be back.
Talking about another star who has a history of knee issues, and that's Spurs center Victor Wembanyama. And he had a collision with Anthony Davis on Friday. Hasn't played since. Listed as a right knee contusion. You normally hear it, especially with big guys, right? That when they have a knee injury, that it's worrisome, that it can be troublesome. Well, why is it that it tends to be anyway, or at least from the outside looking in, it seems like big guys have more trouble getting over knee injuries than other players. Is that accurate? And if so, why is that?
I mean, a lot of it is even like, because I know you mentioned like in the question before was the weight, how heavy the patient is. Big guys are just heavier, right? And I always joke in the office, but I'm telling the truth. We live on planet Earth with gravity, so they're getting pulled on harder. And the joint, especially the knee joint, is kind of the knee joint. There's not much you can do to make it bigger and stronger. So when you're heavier and you're taller, and there's a longer like fulcrums, it's a little bit physics. It puts those joints into more vulnerable positions, and then when they get injured, they just have more body mass they're carrying, even if they're proportional, and it makes it harder for the joint to recover.
All right, let's stay in the NBA. And, LeBron James, we know that he's spent a lot of time and, money taking care of his body over the years. That's why he's able to do what he's doing right now, at 40 years old. And there's this Netflix docuseries out, Starting Five. The topic is kind of resurfaced about all the money he spends, estimated at $1.5 million a year on what they call a biohacking routine that includes all sorts of things, red light therapy, hyperbaric chamber. Can you explain to our listeners, like, what some of these, designer treatments and routines are, how they help somebody like LeBron James, and why they're so expensive?
Well, I mean, a lot of it, honestly, there's not a ton of legit science behind some of it as far as studies and proving it. But I will say I have lots of patients that try these things, and they do make them feel better. And I think what it's all about is helping like tissue recover. It's decreasing inflammation and allowing, muscles and the hyperbaric stuff, the oxygen, all that, cryotherapy, just helping the tissue and the muscle just recover at a faster rate and keep well. And I think there's a certain extent with LeBron, and you look at Tom Brady, some of these guys they're just different, and they're built a little different, and it's a generalized taking care of themselves. And then you throw on things that can help stimulate tissue to recover and heal. And it's expensive because most of it is outside of the insurance system. So, he's and again, it's because some of it's not really scientifically proven. So you can kind of, charge whatever you want for some of those treatments.
Is there a mental side of that as well? Just like the mental edge of, I'm doing everything I can to keep my body healthy, and you think you're taking the right steps and going above and beyond, and that gives you an edge over your competitor because, again, there's a confidence in what you're doing, and you think you're operating at the optimal capacity.
I think 100%. And again, sometimes we'll refer to it as a placebo effect,
Sure.
but I say in the office all the time, if you believe in something enough and you're doing it and you're feeling better, hey, I'll take it, because it's all about just feeling better and having less pain and more function. So I think there's certainly a component of that.
And talking about, the mental health aspect of this, there does seem to be a focus, especially lately, on studies concerning the impact of an injury and the recovery from that injury on younger athletes. As a former hockey player and a team physician for younger athletes, how does a serious injury affect one's mindset? And are there ways that, the mental approach can be addressed during injury recovery? And I guess how important is it to address the mental side of that when somebody's recovering from a really serious injury?
Yeah, it's hugely important. In our studies, say for just ACL injury in younger kids, that's actually the leading factor that stops a lot of them from getting back to their pre-injury status is kind of the fear of recurrent injury and getting over that. And I think it's multifaceted. I actually have a daughter who injured her knee and she's recovering from an ACL, and so I'm watching it firsthand. And a lot of the trust, right? They have to learn to trust that injured body part again, that it can perform at the level it did before. And that, to me, is so much at the rehab, the physical therapy, because you get your strength back, you get your motion back, you start doing things where you realize, hey, this body part, whatever injured it is, say for the ACL or the knee, it works. It can do what I want it to do, but it's a slow build, right? Getting that strength back can take months, and for an ACL, sometimes it's easily 6 months to a year, and really, I think if you talk to most athletes, if they're going to be honest, they'll tell you it probably took them 2 years before they got back to where they were pre-injury. But I think it's a huge component to the point. It's almost one of the most important things.
Yeah, and you use the phrase slow build right there. And again, that's where you come in and your colleagues at SOS, right? Because you're coming back from a serious injury. You have to trust the professionals that are treating you, because the knee-jerk reaction is you want to get back as quick as you can, but sometimes, probably oftentimes, you got to be patient, right? And you got to follow trust the process, as they say, right? Because if you come back too early, you could end up doing more damage.
Correct. And a lot of it's sports specific. Whereas ice hockey, it's smoother. You're skating. It's actually, you rarely see ACL injuries, primarily come out of hockey. But if it's basketball, if it's lacrosse, if it's soccer, those ultra plant cut pivot sports that, you have to have not only the healing of, say, the ACL, and that ligament needs to become functional and it needs to do its job, but then the muscles that are around that joint that protect it and stabilize it have to be working, or you're setting yourself up for failure.
Yeah, really important information, Doctor. Thanks so much for coming on. As always, we appreciate it. Enjoy the rest of your week, and we'll talk again soon.
Sounds good, guys. Have a good Thanksgiving.
All right, you as well. Dr. Ryan Smart, our weekly SOS house call. And with that, we'll open it up to the phone lines, 315-437-7644. We do have a pair of tickets at some point.
Let's do that now.
You want to do that now?
Yeah,
okay.
Let's do caller 5 right now. 315-437-7644. We haven't talked Syracuse basketball yet, so we can do that real quick in this next segment. So,
you're just going to give away the tickets?
Yeah.
Okay.
Yeah,
Syracuse UConn football.
Yeah.
Pair of tickets to the game this weekend.
Why make life difficult on people around the holidays, Steve?
Okay. I'm all for it. I didn't know if you wanted to sweep the nation or if you just felt like giving them away.
I'm not going to make them do anything. I'm just going to have them call. 315-437-7644. Caller number 5.
Man, I didn't know I was saying anything controversial, but it really seems to rub you the wrong way.
I think you just rubbed me the wrong way.
Apparently. All right.
If Kim made Chex Mix, would you say, you didn't really make that, honey? I dare you to try that.
She would never say that she made it if it was just pouring it out of a box. Again, now that I know exactly how it transpired with Alex, that he melted some butter and he put it in the oven, that's different than just like opening up some packages and pouring it into a bowl.
Let's talk hoops, because Syracuse has the schedule of others receiving votes coming up.
All right, back after this on ESPN Radio.